Dear presenters, I call upon the next participant, Dr. Kuye Joseph. I changed them as a presenter now. So based on the public health topic, he's going to present inventions that address poor socioeconomic status are effective in improving non-adherence to tuberculosis treatment, a secondary research approach. I call upon Dr. Kuye Joseph.
Top of the hour to everybody. I'm Kuye Joseph. I'm an epidemiologist and a health educator and promoter specialist. Okay. The presentation for today is interventions that address poor socioeconomic status, are effective in improving non-adherence to tuberculosis treatment. As a way of introduction, tuberculosis, which is popularly known as TB, is a serious public health problem. Its control has faced various challenges globally. In 2020, WHO estimated that 9.9 million people were estimated to have TB disease, of which 38% and 11% were women and children respectively. And also 1.3 million people were estimated to die from this disease. Finding missing TB cases has always been a long-term challenge for TB control efforts. For instance, in the same year, only 64% of the estimated TB cases were notified. Next slide. Despite this global challenge, TB control effort has also, of recent, been complicated by the emergence of TB HIV and poor TB treatment outcome. In 2015, WHO, that is the World Health Organization, identified poor TB treatment outcome as a public health threat that deserves urgent public health attention. We define poor treatment outcome as a TB death combined with other unfavorable treatment outcomes such as loss to follow-up, failed treatment, non-evaluated. When you combine all of them together and they are greater than 10%, we could say that that's a poor TB treatment outcome. So adherence to TB treatment is a major challenge, like I've said, and unfortunately, TB patients face several difficulties that made treatment adherence even nearly impossible. So identifying the primary risk factor for poor TB treatment adherence should be a top priority on the agenda of public health discussions. The purpose of this paper is to explore how theories, concept of behavioral change can be used to improve adherence to TB treatment. So the aim of the paper is to demonstrate that application of theories or concept of behavioral change is a cost-effective and valuable strategy that could be used to address issues of a poor TB treatment outcome or treatment. Yeah. Next slide. So what is the problem? The main problem is that a low TB treatment success rate that is less than 90%, resulting from poor adherence to treatment, is an emerging global health issue. Currently, it is a leading cause in the rise of the worldwide scourge in multi-drug resistant TB, and of the 6.1 million rather TB cases that were notified in 2020, 26%, which is about 570,000, had a MDR TB. Poor adherence associated with determinant of health that influence behavioral change is a critical factor when it comes to TB control. So we are using the data for 2020 because currently you have data only for 2020. The data for 2021 is not currently available from the WHO. All right, thank you. Next slide. Now the problem continues. The condition in which people live, and you will agree with me, the condition in which people live, which they work, and their age are some of the factors that influence their health and how they respond to health-related issues. Several factors directly or indirectly influence behavioral change, which in turn impact how an individual reacts when they are faced with health-related issues. And individually, I think we've had those experiences. Some of these factors include socio-economic status, the literacy level of individuals, the age, gender, the environment which they live, their genetic makeup, psychology, and their family dynamics are all factors that actually affect the way people react to health-related issues, particularly TB and TB-HIV. Next slide. So like I've said in the introduction, this is a secondary research, and the approach that was used included adopting critically reviewing studies with evidence on strategy that have effectively improved TB treatment, non-adherence arising for poor socioeconomic status. And the main methodology or strategy that was used was to review the literature, and the study focused on identifying social determinants of health that influence poor adherence to TB treatment. It also explored to what extent socioeconomic status influence TB treatment adherence. It also identified evidence-based strategies that have been used at different levels, at different settings to improve non-adherence to TB. So that is the focus of the literature review for this secondary research. Next slide. Based on this, an extensive online search of several databases using search engines from the Walden University Library in the US, the Google Scholar, Medline, and the Cochrane Library, where an extensive research was conducted using these search engines. And key search terms or keywords used for this literature include tuberculosis, adherence, social determinants, and treatment outcome. Of all the materials that were reviewed, 20 materials from the several articles that were scanned and reviewed were chosen for the literature review, and only English and the peer-reviewed articles or journals that were published in the last 8 years were considered for this review. Next. So now, what are the results and what are the discussions concerning this secondary research review that was done? The hypothesis for the research was that theories and concepts of behavioral change are a cost-effective strategy to address poor TB treatment outcomes that arise from non-adherence due to poor socioeconomic status. And the result that was found from this review shows that a significant effect in the same direction as hypothesized. And what does that mean? It means that the research agreed that theories and concepts of behavioral change are a cost-effective strategy to actually address poor TB treatment outcomes, or particularly those that are arising from non-adherence due to poor socioeconomic status. At the individual levels, it was found out that demographic factors such as extreme of age, low health literacy level, poverty, male gender, and the poor socioeconomic status are essential barriers that actually affect adherence to TB treatment. And this was clearly shown in all the 20 papers that were reviewed. At the interpersonal level, factors such as family dynamics, which include low-income family or lack of peer support, stigmatization, and failed marriage, that they play a critical role in shaping individual adherence to tuberculosis treatment, and particularly to other health-related issues. Also, together with the individual characteristic, the socioeconomic environment in which people live to a reasonable extent influence how well they will comply with their TB treatment. Supporting costs incurred during TB treatment, provision of psychosocial support, and community engagement are cost-effective strategies that were found to address non-adherence due to poor socioeconomic status. And all of these findings are actually in keeping to support the hypothesis that was designed for this for this research. These are some of the references. Over 20 references were used, but just for the purpose of this presentation, I was able to just bring about 5, which are very key to this presentation. I will share my email, so that if you want some of these other other references, they can be shared with you. Next slide. Okay, yeah, so as a way of concluding, I would say that social determinant of health across the spectrum of the socio-ecological model influence adherence to TB treatment and hence TB treatment outcome. A proportional relationship does exist between an individual's socioeconomic status and their level of adherence to their TB treatment. And like I said, one finding is also that apart from TB, other health-related issues are also affected by this social determinant of health. And I would like to conclude by saying that if appropriately implemented, interventions that are targeted at addressing socioeconomic problems faced by TB patients could in effect enhance their adherence to TB treatment and in turn improve their TB treatment outcome. So some of the recommendations, particularly for National TB Program, WHO, and other stakeholders involved in TB and TB HIV control, is that when patients get good support at all levels of the socio-ecological model, both at the individual level, at the family level, at the community level, at the population level, they are likely to adhere to their treatment. At the end of the day, we could actually solve the problem of non-adherence to TB, which is currently a threat to TB control globally. Thank you, everyone, for listening. I will now stand by to get your questions and answers. Thank you.
Dr. Kuye, thank you so much for your presentation. Participants, you can post your questions in QA box or chat box. Dr. Kuye will respond to the same. Dr. Kuye, we have a question. What measures do you think can be implemented at the community level for active identification of TB cases and subsequent enrollment to treatment and adherence to treatment?
Okay, yeah, thank you. At the community level, which is actually a very critical point for TB control, family support and community support is critical to either identifying the people with TB and supporting them on treatment. If you look the way most TB programs are designed, they emphasize on patients coming to the facility, the health facility, to get treatment. But when you take it in environment where interventions have been done and treatment, diagnosis and treatment have been taken to the community level, you see a significant increase in both case notification and treatment outcome. Because people who have TB are already poor. So one of the factors from the review that affect their treatment is their inability to want to go to the hospital because they don't have money. So that's one of the factors, aside other behavioral factors that actually affect. So I would like to say that when you take the treatment and diagnosis to patients in the community, you are likely to address the issue of non-adherence to TB treatment. I hope that answered that question.
Thank you, Dr. Kuye Joseph. I'm having a question from the chat box. When you say socioeconomic problem faced by patients should be addressed, does your literature more focused on which socioeconomic aspect?
Okay, yeah, yes. So the review basically was to see how socioeconomic status, affect TB. And we found out that people who have good social economic status, particularly in the higher level of the socioeconomic ladder, their response to TB treatment is higher compared to people at the lower level. However, other factors beyond socioeconomic status have effect on those other individuals. But when you put other factors constant and you look at the socioeconomic status, the lower you are in the hierarchy of social status, the more likely you are not likely to adhere to your TB treatment, and the more likely we have high, poor, unfavorable, or poor or unfavorable TB treatment outcome. Okay, I'm seeing one question on the chat box. I think I can look at that. That says, I've seen partners supporting MDR TB patients with food hampers, knowing that most of patients are coming from low socioeconomic status. Beyond that, how do you think Ministry of Government by Life can factor this support to TB patients? Yes, I think that there's a lot of evidence to government, to Ministry of Health, that shows that when you support MDR TB patients with feeding, they are likely to do well. But the problem is this is not a priority usually for most government, particularly in the low economic country, developing country. So the government have this information, and beyond all reasonable doubt, they know that when you support patients with some form of transportation, food packages, they are likely to do well. But the challenge is that government do not give priority to this. So how do you address that? The way to address this is by showing evidence, and also to look for a way to advocate to government, because one challenge with government also is that there's always change in government. They will tell you that government is continuum, but in the real sense, every government comes with his or her own priority. So I think it is the responsibility of the program managers, the partners, particularly maybe the WHO, USID, to advocate to government for them to see reason to prioritize providing support for patients who are on TB and MDR TB treatment. Okay, what happens to patients with other ailments like HIV, etc.? How is this adherence possible? Yes, like I've mentioned, some of the factors that affect TB adherence actually cut across other health issues, and the same interventions can actually work for other health related issues like HIV. Particularly if you look at TB HIV patients, in the some of the studies that were reviewed, the same strategy worked for TB HIV patients. A study from Liberia, okay, shows that among TB HIV patients, when they were given a lot of support, even including patients who had leprosy, when they were given psychosocial support, the TB notification, TB HIV notification, leprosy notification, and treatment outcome among this group of patients increased significantly, okay, compared to the previous 2 years. So I think the same finding from this study is likely to also work for other health areas apart from TB. Okay, having explored several factors related to behavior that influence treatment adherence and outcome, how could your finding help improving TB treatment adherence and outcome among the general and also key TB population who are more affected? Yeah, sometimes having focused intervention for TB patients is very important. In the general population, first, the knowledge about, if you remember, in one of the factors that were identified, low literacy level was actually a major challenge. And this is not just low health literacy level for TB, but generally, people who have low education are not likely to appreciate information concerning TB on how to adhere to their TB treatment. So part of the intervention, apart from providing psychosocial support in terms of food supplement and transportation, is to improve community awareness among the community, so that both the general population and the key population, okay, particularly the TB patients, those of them living in the slums and the undeveloped area, can be empowered through TB in the education. Then you can now bring into bear other issues concerning counseling, other issues concerning psychosocial support. But central to this, providing adequate information to TB patients and the general population in general, I think is an effective strategy. And all the studies that were that are related to this, that were reviewed, pointed this out clearly. What is the relationship between socioeconomic status and TB optimization in the community? Yes, there's a proportionate relationship that I would say that the relationship is proportional. Okay, the more the socioeconomic status of a patient is better, okay, the more they are likely to be educated, and the more educated they are, the more they appreciate TB information. Okay, and the more their level of exposure to TB information, okay, the more they are likely to optimize information, service provision, and treatment services at the community level. So in essence, when you increase level of awareness at the community level, and by doing this, you also need to disaggregate by understanding the literacy level of the people who you are talking to, because it is not the same information you take to a well-developed environment that you take to the TB, or educationally low TB population. So you need to target your information for them to be able to optimize whatever information that you have. And most of this information cut across both at the individual level and at the community level. I think I've been able to answer a lot of, okay, there's another question here. Can this intervention be used for chronic diseases which are on the increase and no free treatment available for TB and HIV? Yes, TB is a chronic disease, and there are other diseases that are of chronic nature. For instance, people who live with HIV, some of them, they have TB disease throughout their lifetime, okay? So the same intervention and the findings that we found in this research, this secondary research, are shown clearly that they can be useful for patients with chronic disease like TB, HIV, like leprosy, because these are debilitating diseases that affect the entire lifestyle of the patient. So I think these are also important, particularly for infectious disease, because there are other chronic diseases like hypertension and diabetes that may need other form of intervention. But clearly, the issue of providing information cut across all form of chronic diseases, whether infectious, whether of the non-infectious diseases. Okay, but when it comes to TB patient, particularly HIV patient, patient with leprosy, the issue of psychosocial support while they are going for their treatment is very critical compared to the non-communicable diseases. Lastly, I'm seeing another chat here. Do you think differentiated service delivery model, like family model as used in HIV care and treatment, can help enhance adherence in TB treatment? Absolutely, I agree with you. When services are differentiated, you are likely to improve not just the quality of services, but you are likely to address issue of operational. There's a lot of operational issues that make intervention not to be optimized. So when you differentiate your services, just like you have suggested in the chat box, you are likely to address some of these issues. And like I said, we found out that when services are taken from health facility to the TB patient in the community, it in essence improve their adherence, not only adherence to treatment, even their desire to access diagnostic services, and at the end of the day, improve their TB adherence to treatment. And at the end of the day, we have a good health outcome, which overall impact on their overall health. So I think at this junction, I've been able to answer all questions. Okay, there's another question again. Who give the psychosocial support? All right, yeah. Is it government or institution? Psychosocial support cut across all the social ecological spectrum. It can be given, it starts from the family level of at the community. The community is involved, and at the environmental level, both the government and institutions should provide psychosocial support. But like I've said in the findings, that government rarely provides psychosocial support, and the reason is because it is not usually their priority. So some of the
Dear participants, the polling is open for the presenter, Dr. Joseph, on the title, Interventions that address poor socioeconomic status are effective in improving non-adherence to tuberculosis treatment, a secondary research approach. Please poll for Dr. Joseph for the presentation done on the public health.
Okay, I have shared my email so that there are
Okay.
other questions. That
Dr. Joseph, please share your email in the chat box.
Okay.
And also,
Okay,
participants,
please
poll for Dr. Joseph. Thanks, Dr. Joseph, for the wonderful presentation.